Walker, the dentist from Restoration Sleep Solutions. I help people to live longer and feel better by getting screen tested and treated for obstructive sleep apnea, or OSA. OSA occurs when the airway is blocked and breathing is stopped for 10 seconds or more. OSA is like high blood pressure. It's silent, so you don't always feel it. Contrary to popular belief, people who are young, fit, and trim can also have OSA. Since it occurs while we're sleeping, we often don't wake up enough to realize that we have stopped breathing. Today I want to share my personal experience with OSA. After my doctor advised being tested, I put it off for several years. My kids were young and I had some hesitation about leaving them overnight and having people watch me sleep in the sleep lab. When I finally did get tested and treated for obstructive sleep apnea, it changed my life. I wish that I had done it much sooner. Without changing my diet or starting an exercise program, I lost 25 pounds within the first 6 months. Once I got comfortable with the right mask on my CPAP, I loved it. I felt so much better in the morning when I'd wake up after sleeping all night long and being able to breathe. Fortunately, my husband was very supportive, and he didn't mind the noise of the CPAP machine. Whenever we traveled and all shared the same hotel room, the noise would keep them up all night. It was definitely not their favorite. The other issue I would have with the CPAP was when I had to get up in the night and go to the bathroom or check on the kids or take care of the pets. I would have to turn off the CPAP and take off the mask, which is really not a big deal, but I would often be so tired that when I went back to bed, I would forget to put the CPAP on. And so then that left a portion of the night where I wasn't sleeping with the CPAP. But overall, the CPAP was a huge blessing and I was thankful for it. However, about 2.5 years ago, I started having my normal neck pain started really increasing. And I was diagnosed with severe spinal stenosis, and my spinal cord was actually being compressed by my discs. So I had to have disc replacement surgery. And at that point, I could not stand to have the CPAP touch my face at night. Anything touching my face or my neck was just too much pain. So I ended up having to stop the CPAP. As a dentist, I started researching the benefits of oral appliance therapy for obstructive sleep apnea. The oral appliance works by holding the lower jaw forward and keeping it that way so the airway is opened. And the more I realized that there are so many benefits to oral appliance therapy, the more I realized that with my life, what I wanted to do is help people to be screened, tested, and treated for oral appliance therapy. I now have one. It helps me all through the night. I feel my airway open, bigger when I put it in at night, and I don't have to take it out when I get up to go to the bathroom or check on kids or pets. My kids are teenagers now, so I don't have to check on them as often. But even if the electricity goes out, my oral appliance is still working. So that is my personal experience with obstructive sleep apnea to this point. If you have any of the symptoms of OSA, which are daytime sleepiness, fatigue, memory issues, mood swings, depression, anxiety, there are just a whole bunch of things that go along with having obstructive sleep apnea. And then there's health conditions that are actually comorbidities associated with it. High blood pressure, diabetes, obesity, heart disease, atrial fibrillation or other irregular heart rhythms, stroke, acid reflux, again, depression, just a lot of issues that are related to having the obstructive sleep apnea. And once that obstructive sleep apnea is successfully treated, a lot of times these conditions can improve. Now, it's not a panacea, it's not going to cure everything, but definitely getting that oxygen to your brain and to your heart at night when your body is recovering, that is essential for good health. And for most people, we can now do simple home sleep tests, so you don't have to go to the lab and have the sleep test done. we can get it to you and you can do it from the comfort of your own home. So I would suggest going to my website. It's www.restorationsleepsolutions.com and fill out a screening form. My screening form is HIPAA compliant and it's secure, so your personal information is not going anywhere. And it is a 90% accurate at predicting whether or not someone will test positive for sleep apnea. So once that screener form is filled out, our office can give you a call within 72 hours and let you know if you would likely test positive for sleep apnea. And this is Dr. Tiffany Walker, and I thank you for your time.